Hello, everyone. It's Dr. Lisa L. Campbell wishing you a warm welcome to week number one of your outpatient billing and reimbursement course. I want to just really call out that last semester, when you had inpatient billing and reimbursement, we used the book that was written and published by AHIMA, and that book really introduced you to reimbursement methodologies. And so you're going to see in this course, there are some concepts that you're thinking, oh, you know what? I understand it better this time. And this book is written by a different author. And so, everybody has their own thoughts about how to present information. Not saying that it's bad, but you will really hone your skills this semester. All right. So, before I get into our activities for the week or our content for the week, which is chapters 1 and 2. Chapter 1 being health insurance specialist career. And then number 2 is the introduction to health insurance. I want to pause and really call out the why, right? You're here because you want a new career. And in our program, as you know, we are an AHIMA PCAP program, and we prepare you for the CCSP or the CCS. I will say that there are other exams that you can take, such as through the AAPC. That exam itself is not covered in our tuition costs, but certainly after you finish your AHIMA exam, you can definitely go for another certification. So, on the AHIMA website, they have information about each exam, and one of the pieces of information is regarding what books you are to bring to the exam. So, you all are going to be taking your exam August of 2025, and you will need the 2025 coding manuals. And I like to just continue to reiterate that just in case you're online, so I can't see you. Just in case you didn't buy one of the manuals, I just want to be clear that you will not be allowed to the exam if you don't have your manual. Okay. So, CCSP, CCS, it's January 2025. You're not sure which one you want to take. I will tell you that graduates in the past have decided to take both, the one that's included with the coding practicum, and then they pay for a separate one, just so that they can have both credentials as they seek employment. So the second thing is each exam has a content outline. And I like to refer to the content outline mm, as the floor of what you need to know and not the ceiling. So, just to move this conversation along, I pulled out portions of the content outline for the CCS and the CCSP because I really wanted you to see why it's important to develop knowledge, comprehension, and application of the topics that you're learning so that when it comes time to review this summer, you're just reviewing and not having to learn something for the first time. So, the CCSP exam, Domain 2, is titled Procedure Coding. And this is not your coding class, this is the reimbursement class. And so, I really just wanted to call out task number 5: demonstrate appropriate use of NCCI edits and guidelines. You were introduced to that in your last reimbursement class. You're going to see it again, but I really wanted to be intentional and give you the why. All right, domain 4 of the CCSP exam. And if you don't remember, CCSP is for coding for the physician, the professional, so the physician or nurse practitioner or physician assistant. So let's see here. I'm drawn to task number 10. Understand when it's appropriate to have an ABN signed. That was covered last semester. You're going to see it again this semester in this book. Incident to billing guidelines. I can't recall if that was covered last semester. I'm going to have to look at my notes. I'm going to make myself just a written note to make sure that that's covered. And I need to look at this book and see if that's there. So remember, I said this is the floor of what you need to know and not the ceiling. And I'm saying that because everything that's in a textbook is not necessarily everything you need to know about a topic. So you must be willing to go beyond the book, to go beyond the content outline. Um, and some topics are a industry thing versus a theory thing. But nonetheless, what else is here? Hmm. Identify the appropriate place of service. So remember and if you haven't gotten the chance to listen to the week one lecture for the CPT class, depending on what order you do your work, but place of service is something that I talked about in the week one lecture. The place of service numbers are listed in the inside cover of your CPT manual, and they do correlate to the CMS 1500 claim form. All right. There are in this book, you will see about HIPAA again, but you have your legal class that starts the second 8 weeks. And so you definitely will learn more about HIPAA again. And I know you're like, whoa, this is a lot. So if you're like, I don't know, CCSP, CCS, not to worry. I think when you get to intermediate coding 8 weeks from now and you're just straight coding, you will decide what system or which exam you want to take. And I I would like to recommend that you follow Rivka Stearns Stearns or Stevens um, on LinkedIn. If you can't find her, let me know. But she is a brand new coder, just celebrated her 1 year anniversary as an inpatient coder. And she talked about how in her program she learned, identify which system she really enjoyed, which was ICD 10 PCS. But again, I'm just gonna give you my 2 cents. I think you should graduate and take both exams, right? One after the other while the information is fresh. Okay, so let's see. Hmm. I tell you, these two classes are closely related. Number 3, demonstrate the financial impacts of the RBRVS system. I talked about that in the week one lecture for CPT. Associate the diagnoses to the appropriate procedure. You are definitely going to learn about that in this course. Understand HCCs. And this is another area, actually, number 5 and number 6, that I need to reconfirm that it's in our textbook. And if it's not, I will provide some additional guidance on HCC's risk adjustment because I want you to be ready for that exam. And then differentiate the types of denials. So, wow, 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 wow. CCS exam is next. So here, number 7, coding edits, NCCI, medical necessity. 8, reimbursement methodologies. You learned about all reimbursement methodologies in your inpatient billing and reimbursement class, and you're going to learn about them again here. Repetition is the key. All right. So I spent a lot of time talking about this, but I just wanted to be clear. I wanted to call out here adherence to AHIMA standards of ethical coding. And basically, what this means is you A, need to download the AHIMA standards of ethical coding, and B, you need to read them so that you can do three things. And if you don't hear anything else that I say in week number one, hear this. On the day of your national exam, you need to understand the concepts that you're being taught. You need to comprehend them. You need to apply them. Okay. So maybe let me rephrase that: knowledge, comprehension, application. You need to have knowledge of the topic. So when you see HACs, you need to know what that is. But then, so knowledge, comprehension. So comprehend how they apply. And then third is obviously apply them. AHIMA's exams have three cognitive skills that you need to know, which is recall, analysis, and application. All right, so now on to chapter one, and we'll see how long this lecture is, and I'll decide if I need to break it into two parts. I do understand that when you have a lot of information, it's easier if I break it down into chunks. All right. So, chapter one, you're not, more than likely, you're not here in this program. Our program is called Coding Specialist, right? It's not called Medical Billing and Coding, it's Coding Specialist. So, more than likely, you are not here to become an insurance specialist. However, you may work a job that requires you to have knowledge of this information. You certainly will need to know about it for the exams. So it's information that, you need to know. So, objectives, key terms, you should be able to define them. You should be able to understand the health insurance claims processing, career opportunities, education and training requirements. This is what I call the easy chapter. The responsibilities of the health insurance specialist, differentiate among the types of insurance that's purchased, the role of workplace professionalism, telephone skills. And I know you're thinking, I'm not going to be on the phone in my job. Well, you might be on Microsoft Teams or some other platform where you have to communicate verbally with other professionals. And so you're not just going to be hiding behind your computer. And then lastly, the professional organizations. So here is the outline for the chapter. I'm going to just skip through that and go straight into key terms. I I review a lot of blogs for professionals who are preparing for the exams. And it doesn't matter what exam you're preparing for, you got to know the terminology. And so flashcards are a way for you to learn terms one word at a time. So my recommendation, beginning of each chapter, there are some key terms. Make some flashcards with those terms and then learn the terms so that you can understand, apply all the things. I am personally studying for an exam, and I was able to purchase flashcards, and it's not a coding exam, but the flashcards were pretty pricey, but the flashcards didn't include all the terms that I needed to know. And so I found myself making some additional flashcards. But when you write, and I do a lot of reading and writing, but when you do those things, it's an active learning process. All right. So what is a health insurance specialist, right? It's someone who is well versed in claims processing and billing, also understands coding. And I will tell you, if you are a biller, You may not be as involved with coding, but you do need to understand it. Um, you also can appeal a claim that was denied or we weren't paid all our money for. Also, being professional and again, just having all the skills. One of the things that I think is often underrated is the professionalism aspect. Many employers will refer to these as soft skills. And in this virtual world, I think a lot of times we miss those skills because we're sitting behind the computer. All right, so there are a couple of areas that you need to know related to health insurance. And so you see those items listed here, some of whom you know already, but I'm going to continue. So make sure that you know those terms. So I want to call out medical necessity. And medical necessity is really about where, and this is a connection to week one for CPT, but it's about being able to show the insurance company what happened today and why. So if you look at these two examples, and in particular, example number one, procedure, knee x ray, diagnoses, shoulder pain, not medically necessary. Now, your patient could have more than one procedure, more than one diagnosis. And on the claim form, one of the things you're going to learn about is the concept of linking the diagnoses to the procedure. Then the second example is correct. There's a chest x-ray and the patient has shortness of breath. Those examples are in your textbook. So if you want to re-review them, they are available for you. All right, so career opportunities. There's so many opportunities in this profession, but let me be very intentional by saying if, and actually Rivka said this recently when she did a presentation. Yes, she's 1 year into her career and she's doing presentations. Love it. Also, I should call out that she's on the advisory board for this program. And so she's bringing that new graduate, recent student expertise to the table. Okay. So if you want to be a coder, then that's what you need to focus on. I'm going to talk more about this, but not today because I need to continue. Now, there are other opportunities for those who don't want to be coders. They want to, get into other areas. I personally started in healthcare in 1992 as a medical assistant and grew from there. But let me just tell you something that's key. When I became a medical assistant, I knew that I wanted more. And so I didn't stop there. And anytime I worked a job where they wouldn't allow me to grow, I left because I am all about growth and that's critical. All right, let me keep going. So the training requirements are definitely consistent, but I will tell you that I believe for a coding professional, you definitely have to have what I like to call the language of medicine. And that would be medical terminology, anatomy and physiology, pharmacology, disease process. Those to me, and henceforth, that's the reason why those are prerequisites for this program. But those to me really lay the foundation for everything else, right? You definitely have to have written and critical thinking skills. And you all will have your internship or coding practicum this summer. And it's really designed to take you to the next level. And you're going to be doing real coding, not fake coding. All right. So the responsibilities, and let me just tell you, every organization, if you go on Indeed, you look at job ads, you'll see that every organization has some similarities in terms of what's required for the job. And then they certainly have differences. Okay. And when we talk about the scope of practice, this is basically, what you are allowed to do. And I just want to call out that every organization is different. All right. So here the book gets into the concept of an independent contractor versus employer liability. And so I'll use myself as an example. When I was heavily involved with coding audits, I had professional liability insurance. Actually, I still have it, but anyway, but for different reasons. I have professional liability insurance, and basically, it was like $300 a year. And that was because I wasn't tied to an employer. And so, in the event of an error, I wanted to be protected. And organizations, when they hire you or contract with you as an independent contractor, they don't cover you, right? And so when you are an employee, you're covered, but when you're an independent contractor, you are not. And so the chapter goes on to talk about, what is an independent contractor. The IRS has a test to make a decision as to if someone is a contractor or an employee. And basically, when you're a contractor, you are responsible for your the cost to operate, to provide your services, your manuals, all of that. You also decide when you are working and when you're not, right? So you are in charge of your own life, but I like to say you pay the cost to be the boss. All right. So here is a list of insurance that is covered, purchased by employers. And if you are already working a job, you know about workers' compensation, right? Um, so I won't get into that. A professionalism or soft skills, I just cannot, and this is definitely going to be a two-part situation because I don't like going more than 30 minutes. But as a coding professional, you must remember that your first, our first impression of you is our impression. But number two, you want the employer to see that um, you are a person of integrity. You are a person that works well with others. You are a person who conducts themselves like a professional. And I'm kind of struggling with the words because oftentimes, and I find this with younger people, you don't necessarily know what it means like to be a professional. So here's what I would recommend: get a mentor, someone that's already working in the profession, and they can help you. Two skills you really need to have, I believe, are emotional intelligence skills, and then the soft skills, right? So here are, and this is covered in the book, a list of skills you should have as a professional in the workplace. I encourage you to review all of these and um, be able to apply them. Okay. Telephone skills. So now I know you're like, why is this in the book? Well, let me tell you, if someone is working as a straight biller, health insurance reimbursement specialist, they probably will be on the phone with insurance companies. They could be on the phone with other offices. You never know. And when I look at the telephone skills, how they have them listed here, my thoughts are this is someone that could be working the front desk. In the office, and they're taking phone calls, and you guys didn't come here for this, but this is just again what's included in the chapter. um Sometimes people say, I'm going to just take a job in the hospital, like patient access, just to get my foot in the door, so that I can become a coder. So two things I want to say. If you want to be a coder, focus on coding. The other thing I want to say is that if you do take that type of job, you need to have an expiration date as it relates to how long you're going to be there. Because if you want to be a coder, you get those coding certifications, be a coder. All right. So there are several professional organizations that they highlight in this chapter. And I just kind of smile when I look at this page because I am a member of AAPC and AHIMA. I have credentials with both, but I started my career as a medical assistant and I was a CMA. So, you really want to think about how you can grow in this profession. So, the last part of this chapter that I want to cover are just some self assessment questions that you should really think about and um, reflect on. So, one being, which concepts do you find most difficult? From your reimbursement class last year, you probably are thinking, ooh, calculating those MSDRGs, that was a little challenging. Your final project, I think you did some case mix. I can't remember because that was like 2 months ago. But anyway, what your thoughts are on becoming an independent contractor instead of being employed. I will tell you that independent contractor is something that you typically do once you get some experience. And then lastly, how would membership in a professional organization help you further your career? And let me just tell you, membership has its privileges. A lot of times, as a member, things are cheaper for you in terms of resources that are available, attending conferences. But the last thing I want to just leave you with is I think it's very important for you to become involved with the organization. So we're here in Illinois. I would highly recommend that you volunteer with the Illinois Health Information Management Association. There's a conference coming up in March. You definitely should attend as a student because in this industry, it's not just about what you know, who you know is as equally important. All right, so I'm going to end this week one lecture here. We'll call it part one. I'll come back and do part two, where I will get into chapter two. Bye bye.